Knock, knock. Provide patient privacy. Wash my hands. Hi, I'm Kaylee. I'll be your nurse today. I've reviewed the doctor's orders and we have to change your dressing for your wound. Is that okay? It is, okay. I gave you a pain pill about 30 minutes ago. How would you rate your pain? 2 of 10, is that acceptable? It is, okay. Well, I'll just get my supplies ready and then we'll change your dressing, okay? Okay, I'm just gonna pull the blankets back so I can see the wound. Did you want a bath blanket for up here? You're warm? Okay. Before we start, can I get your name and your date of birth? Annie Gray, 5/19/69. Good, okay. So I'm just gonna take your wound, old dressing off your wound here. There's no leakage around the outside. I'm gonna hold your skin so it doesn't pull. And take the top layer off. There's no drainage, so it's healing good. Just a little serous drainage, which is clear, yellowish, but that's normal. It's still healing. A little bit on this one. Okay, this might pull a little bit, so that's normal, but it might hurt. Just feeling for tunneling. And your wound looks red, so there's granulation tissue, which means it's healing, and that's good. Okay, I would wash my hands now and get my sterile field set up. Checking all the packaging to make sure it's not outdated. And then I would sign an initial and date and time this so that it can be used for 24 hours after it's open. have my assistant hold these until I'm ready. Okay, now I'm just going to clean your wound. Are you still doing okay? Okay, now I'm going to measure the length. Is 19. And 4. And 4 again. Okay, now I'm going to pack the wound. feel okay? Good. And now use dry ones on top. I'm careful only to touch the back side. Does that feel okay? And then I would have to write my initials and the date and time so they know when it was last changed. How would you rate your pain now, Annie? 2 of 10 still, is that acceptable? It is, okay. Did you want to stay laying flat or do you want your head up? You want to stay down? Okay. And here's your call light. So if you need anything, you push the button. And I would clean everything up, wash my hands before I leave, and then go document how the wound looked, her pain before and after, the drainage, and how she tolerated the procedure.